It can be really confusing knowing which doctor to go to for your PCOS. There are so many doctors out there, and who you go to see really depends on what symptom you're trying to treat at the time. But we're going to be talking a lot more about that in this video. My name's Taryn. I'm the founder of PCOS Diet Support, and I talk a lot about PCOS, what it means for us, and how we can manage it. Now, I recently did a survey of my PCOS Diet Support community on Facebook, asking them which doctor they go to see for their PCOS. So these are the results that we got. Okay, I'm going to move this up so that you can actually see it. So about 45%, 46% of my community went to go and see a gynecologist, and the gynecologist takes the lead for their PCOS. About 28.6% went to go and see an endocrinologist. We're going to talk more about each doctor and what their roles are. About 14% are treated by their general practitioner or GP. I guess that would also be your family medicine doctor. About 5.7% go to a reproductive endocrinologist, and another 5.7% actually don't see anybody. Okay, so we're going to talk about which doctor would be helpful for when, and let's get onto that. So the first thing that I want to talk about is your general practitioner. Okay, now your GP, I go to my GP for my PCOS. I don't have any specific symptoms that I'm trying to treat at the moment. I am not trying to conceive, so I'm not struggling with infertility. I am trying to manage my weight as much as I can by through my diet. I take supplements, so I am generally speaking healthy. However, it is so important that we monitor our PCOS as we age. We know that women with PCOS are more at risk of things like cardiovascular disease, insulin resistance, type 2 diabetes. The list goes on. And as we age, our symptoms are going to change. So I go to my GP every 2 years. This is for me personally, okay? I go every 2 years and I ask for blood tests to monitor my thyroid levels, my hormone levels, my insulin levels, my cholesterol levels, just to keep an eye on things. As things change and progress, should I need any further help, she can then refer me out. It also really depends on what country you are in, okay? Normally what would happen is your general practitioner, they are experienced in a huge range of kind of symptoms or diagnoses. And so what they would do is they would possibly run a screening test. If you were to be diagnosed with PCOS, they may then refer out. But very often, your general practitioner is your first port of call. Now, or one of the other people who may treat your PCOS is your gynecologist. And this makes sense, okay? We know that PCOS is linked with irregular menstrual cycles, with ovaries. Who is the doctor that deals with women's health? Your gynecologist. So a lot of people will go to their gynecologists for treatment. Now, something that you haven't or that you may not have considered is an endocrinologist. And the reason that an endocrinologist can be so helpful for your PCOS is that an endocrine doctor is a doctor who specializes in hormones. Okay, we know that PCOS is ultimately a hormone disorder. It is fundamentally an endocrine disorder, and that is why an endocrinologist can be so helpful in helping you to treat your PCOS, okay? Because they will look at the underlying hormone imbalance, they will look at insulin resistance, they will have a good grasp on what hormones are impacted by your PCOS. So an endocrinologist is also a good option. Sometimes your gynecologist may even refer out to an endocrinologist if they have more knowledge of PCOS. Then the one that you see for a very specific reason and a very specific time in your life is a reproductive endocrinologist. And this is the doctor that you go to see if you are trying to conceive with PCOS and you are struggling. This is exactly where a reproductive endocrinologist can be really helpful. Now that I'm no longer trying to conceive, it is very unlikely that I would go to a reproductive endocrinologist. I would be more likely to go to a gynecologist, in fact, my GP at the moment, or as things progress, if things should change for me, I may then consider an endocrinologist. But a reproductive endocrinologist can be invaluable if you're trying to conceive. Now, you might be wondering, how do you go about finding the right doctor for your PCOS? Now, there are And I say this from working with thousands of women and from listening to thousands of women's stories. It can be very difficult to find a doctor who listens to you, who hears what you are saying about PCOS and doesn't write it off. I recently asked on my Facebook group, what are the most common myths when it comes to PCOS? And some of the answers I was really horrified by. Some people, one woman's doctor told her that PCOS is something that is made up to excuse lazy women. Some doctor told her that PCOS is the same as IBS, irritable bowel syndrome. I don't think so. So I'm not saying that all doctors are bad. Okay, absolutely not. Doctors are important and they have their place, but it's just as important to find the right doctor for you. And if you feel like your doctor is not giving you the help and the support that you need, that your doctor is not listening to you or taking your symptoms seriously, then I really want to encourage you to keep looking. Go and find another doctor. The first thing that you can do is ask for a referral. Okay, so your doctor, your GP, will have a network of other doctors that they are aware of or know of. So if you're going to your GP or your family practitioner, go to them and say, please, can I have a referral to somebody who specializes in PCOS? Once you get to that referral, the next thing that you should do is before you book the appointment, ask the doctor how many PCOS patients that doctor treats per week. Because that is going to give you an indication of their competence with PCOS, of their awareness and their knowledge in treating women with PCOS. So I really want to encourage you to advocate for yourself. Now, if you are looking for a doctor for PCOS, one of the places that you can go to is the PCOS Awareness Association. I think their website, I will link it below this video. They have linked with a company called Amino to where you can put in what you are looking for, your area. This is predominantly for the States, your area, and you can, the Amino will then provide you with a list of service providers in your area who specialize in PCOS. Facebook groups are a really good way if you say, I'm looking for a recommendation of this kind of doctor in this area from a group of women with PCOS. They are likely to give you their experience of different doctors in your area. So that also is a really helpful way. Now, if you have just been diagnosed with PCOS and you want to understand more about PCOS and what it means for you, then I really want to encourage you to sign up for my PCOS Starter Kit. Again, I'm going to link it in the description below. And the Pcos Starter Kit is going to help you understand what PCOS means for you, how it impacts your body, the things that you can do to manage it on a natural perspective, the diets, the supplements, the things that you can do for your PCOS. So if you want to know more about your PCOS, if you're just starting on your journey, then I really want to encourage you to sign up for the Pcos Starter Kit. Again, that link is in the description. Thank you so much for joining me. Give me a thumbs up if you liked this video. If this is something that you would like to know more about, let me know in the comments below, and I look forward to seeing you on the next video.